Around the world, thousands of frontline healthcare workers dealing with COVID-19 have fallen ill and many have died. But as Gerard Escaich now reports, paramedics in Madrid have come up with new protocols to reduce the risk of contamination.
Each call they receive puts them at extra risk of contracting COVID-19. And by the end of the day, emergency teams have seen many patients with symptoms compatible with the disease. Last March, the ambulances of the emergency unit of the Community of Madrid in Spain carried out more than 10,000 transfers. The experience has allowed them to develop a protocol of action to limit as far as possible the risk of being contaminated, as well as wearing gloves, masks and protective equipment. When they arrive at the patient's home, they divide them into different zones.
We take it for granted that the home or the patient's room is contaminated. That's how we've always done it. So that would be a contaminated area, and where you are now, that's a clean zone.
Those who take these measures anticipate risk. Last month they lost a colleague, and in Madrid there are 200 emergency room nurses infected. Although calls to the emergency teams have fallen by half since March, the fear in people's eyes is always present.
We try not to get infected and not to infect the patients we visit because we have loads. My job is either to leave them at home or they move to the hospital. I just keep on moving.
Conversely, the number of infections among healthcare personnel in Spain has increased by 40% in the last 2 weeks, and more than 43,300 people have been infected. Gerard Escaich for Euronews.